Welcome to the Synapse Sessions. Today, we're thrilled to host Dr. Maria Ivanova, an associate researcher from the Aphasia Recovery Lab at UC Berkeley, and a leading voice in the study of aphasia recovery. Dr. Ivanova's work sits at the intersection of language, cognition, and neuroscience, primarily focusing on the neuromechanisms behind cognitive and language deficits in aphasia to better understand how to promote post-stroke recovery. Her research uses a variety of methods to assess cognitive performance, from neuroimaging to language measures, to uncover how cognitive processes influence language recovery. Dr. Ivanova, thank you for joining us at the EVHS Neuroscience Club Synapse Sessions. We're so happy to have you on to share your experience and research.
Well, thank you for having me.
So, just to get started, I wanted to ask, what first drew you into the study of the brain?
Well, my background is actually in psychology, in clinical psychology. And so when I was still an undergraduate student in clinical psych back in Moscow, Russia, that's where I'm from, I was actually facilitating a neuropsychology conference dedicated to Alexander Romanovich Luria. He's a very famous Russian neuropsychologist. And since I was fluent in English, I was kind of translating for a group of delegates from English-speaking countries, and we were on a tour of a neurorehabilitation facility in Moscow, Russia, Center for Speech Pathology and Neurorehabilitation. I was, if I remember correctly, I must have been a second or a third year student at the time, so sophomore or junior. And at this neurorehabilitation facility, it was for people who have had strokes or traumatic brain injuries. They were admitted for inpatient rehabilitation there. And it was really the first time that I saw a person with different neuropsychological impairments, such as deficits in memory, attention, language. And I was again translating a tour of the facility, but I got to see kind of interactions of the personnel with the patients, and I was both fascinated and what's the would be the right word, really saddened by how brain damage can affect an individual's life. I mean, we all grow up knowing what a physical injury can do to a person, like a spinal cord injury. Um, but really, we don't know, at least I didn't know enough, like how brain damage really affected long-term people's ability to function. And just the variety of the impairments, from somebody not being able to speak to somebody speaking in neologisms. I didn't know the term at the time, but really incomprehensibly, to somebody not seeing half of the visual field in front of them. And so I was both kind of fascinated by the phenomena and drawn by the drama, kind of the drama and the trauma of having such injuries and recovering from them. And so from then I started volunteering at the center, did my thesis there, and kind of went on to do my PhD in the area of aphasia.
That's awesome. That's so great to hear. And so this was that sort of like spark in your journey to wanting to unravel that brain and language relationship. And I know now you're a big shot in the aphasia field, but one of the biggest things that you've done was your work on something called the Russian aphasia battery. Could you tell us a little bit about how sort of these linguistic and language measures play into the neuroscience of the brain and sort of the overlap between these two fields that often get sort of pushed apart when we think about linguistics versus neuroscience?
hmm Oh, well, that question holds a lot into it in it. So kind of let's back up a little bit. So when I started working with people with brain damage and sequel of stroke. And what I came to realize that yes, they had a host of different impairments, but really the most debilitating was language communication impairment or aphasia. And research kind of confirms that even like physical motor impairments following stroke, the impairment that causes the most sort of long-term disability and has the most dramatic impact on quality of life are language deficits. In our everyday life, we take this ability to effortlessly communicate like we are doing right now, sort of for granted. We don't think twice about it. But when it's taken away, even in its mildest forms, when it's just like a slight word finding difficulty or a slight comprehension deficit, even that can be quite debilitating, precluding full life participation professionally, with family and friends, with recreational activities. So that's why eventually my interest, even though they were kind of more broad initially, focusing on different cognitive domains, but eventually sort of focused on language, given its impact on people's lives,
Of course.
or kind of impact of a language deficit on people's lives. And that's what led me to do my PhD in the States, specifically in speech and language sciences. And so when I was studying here in the States, I realized that in Russian language, we really lack good quantitative tools to evaluate these language deficits. There is a myriad of different language tests, batteries available for in English that really help professionals working with these individuals to kind of quantify their language deficit. And that is very important to further select appropriate treatment, track progress, and to make predictive claims about recovery patterns. And that wasn't really available for Russian speaking patients. And so when I returned back home after my PhD studies in the States, I had this, I would say at that point, kind of a dream of really developing a quantitative assessment tool in Russian language. I should say there were a few batteries available, but and one of them I've worked with, but they weren't kind of didn't stand up to the psychometric rigor that English batteries were. And so eventually, when we started a neurolinguistics lab that later became the Center for Brain and Language, and so kind of there was already a team of linguists, neuropsychologists working together on different aspects of aphasia. We decided to create the first kind of comprehensive standardized aphasia battery in Russian that would really quantify linguistic deficits according to what we know about language in general and in aphasia today, and kind of allow us to on one hand, from a research perspective, to collect data that would be comparable to the data collected in studies with English-speaking patients, and on the other hand, really help clinicians gain a better understanding of the deficits that their patients have. And so the Russian aphasia test was born. It was a project that ran almost for 10 years. And it was quite endeavor, I must say. A steep learning curve. Now I have a much deeper appreciation for the amount of work that goes into developing any standardized assessment tool. Um, mm, Essentially, we had to collect a large standardized sample of both healthy controls and individuals with aphasia. The healthy controls kind of ensure that the task could be done correctly by individuals that don't have brain damage. And again, some of the tasks can be quite challenging, and sometimes even healthy controls can make mistakes, and that's okay, but you need to kind of establish that normative baseline. And then we had a large sample of individuals with aphasia to really ensure that the test was able to capture a variety of linguistic deficits that these individuals have. And here I really kind of want to emphasize that the test is really based on our kind of understanding of how of kind of psycholinguistics, the understanding of how language is kind of made possible, operates, rather than any specific model of how language is implemented in the brain.
Hmm.
So it's really motivated more by psycholinguistics models of language and what we think are critical components or stages of processing in a given linguistic task. Because how language is made possible in the brain is still very much an open question. We scientists are still kind of exploring and debating with each other what areas are crucial, well, what areas form specific language networks and how they compensate in the presence of brain damage. To give an example, it has for a long time been thought that frontal areas in the brain, especially inferior frontal cortex, is responsible for expressive deficits, specifically those at the sentence level, what we call agrammatic production and comprehension agrammatism. That it's the frontal areas, kind of going all the way back to Paul Broca's, a French neurologist who described the first cases at the end of the 19th century. But in the last 2 decades, that knowledge has really evolved, and now we think that those areas are at best sort of supplementary and supportive for those functions, but that the core areas responsible for syntactical processing are in the temporal lobes. And there's still a debate specifically which area, superior, middle temporal gyrus, and how they sort of work together to support sentence level comprehension. But our test is sort of, I would almost say, kind of agnostic to whether grammar is processed in the frontal or temporal areas. Rather, it includes a selection of different language constructions, like simple sentences, more complex ones that we know can be impaired in aphasia, so we can reliably measure those grammatical deficits, both in comprehension and production, compare them to each other and determine whether a grammatism is sort of domain general or whether it's specific to production or comprehension.
Yeah, and I wanted to latch on to something you said there where we're talking about sort of this nuance in where we're still learning about how language production is organized in the brain and how in the past few decades there's been a sort of movement to better understand language organization. And I know a lot of that work has sort of been aided with the use of new technologies like fMRI and neuroimaging. So I wanted to see, or I know your work has heavily leaned into that side of this aphasia research as well. So I wanted to see sort of how that new technology has influenced current linguistic measures, or if it's still something we're exploring.
Well, it's still definitely a work in progress, although it has provided very valuable insights into understanding sort of the neuroanatomy of language. There are several different neuroimaging techniques out there. So one of them, fMRI, that we call that kind of functional neuroimaging. So in a nutshell, what fMRI allows us to do is indirectly determine which areas are active during a specific task. And here the word indirectly is really critical. So with fMRI, we're not directly measuring brain activity like we do with EEG or intracranial recordings, but rather we're measuring this kind of a signal that indicates brain activity. What we're measuring is a change in proportion of a change in blood flow in essence. So when a certain area becomes more active, it needs more oxygen and glucose to support its metabolism. And there is type neurovascular coupling in that area then indicates to the vascular system that it needs more oxygen, more blood is delivered to that area, and that increase in blood flow is what fMRI actually measures. So there's kind of a lot that goes into that signal, and that signal is very, the change in that signal is very minor. Don't quote me on this, but it's in the magnitude of like 2, 4, 5% change that we are detecting. So it's very subtle. It's a noisy signal as well. So uh, uh, it's not the best way sort of to get an insight into how the brain works, but it's one that's commonly available, that's non-invasive, that you can easily kind of run studies with. But it has been problematic uh, for a number of reasons in individuals with stroke. Obviously, stroke is a disease of blood flow, so their blood flow is already altered in specific ways, and hence the method might not be able to detect their changes as well as it does detect blood flow changes in healthy individuals. Second, the presence of a lesion alters the signal, especially in certain areas of the brain, like the frontal anterior temporal lobes, making inferences about certain areas in the brain problematic, and also introduces additional layer of variability. Not only is each patient has sort of a unique behavioral profile, but they have a unique pattern of lesion making, kind of group inferences more difficult to make.
Mhm.
So while those studies have provided interesting, fMRI studies have provided interesting insights for us, they're very heterogeneous and kind of the findings across studies don't align that well. And a recent meta-analysis basically came to a conclusion that from all of these fMRI studies, what we can infer is that certain activity in the left hemisphere is indicative of better outcomes. So not something very, very specific as we like. What studies have, but that said, I don't want to discount fMRI studies in general. So I think in a way, fMRI studies are more informative and healthy controls in helping us understand how language is done in the brain. So in healthy individuals, things are much easier to run and analyze at a group level since everybody has kind of the same brain, and it's much easier to compare and aggregate signals across individuals. And really kind of summarizing a broad swath of literature, I think the two main insights about language in the brain is that its multiple regions are engaged uh, when doing basically any language task, especially when we get to like sentence level processing or discourse level processing. So it's not a modular system, rather, it's really a network of regions working together and sort of flexibly being recruited to support task at hand. And second, that language processing, while predominantly performed by the left hemisphere in typical right-handers, it's not exclusive to the left hemisphere, with a number of kind of processes are delegated to the right hemisphere, or put it differently, different areas in the right hemisphere flexibly engaged to support language processing.
Mhm.
Um, so uh, now coming back to individuals with aphasia, what I think is maybe a more productive line of research is what we call lesion symptom mapping, or when we look at structural scans of individuals with brain injuries and try to simply put kind of correlate areas of damage with specific symptoms
Hmm.
and hence gain an understanding of damage to what areas lead to what symptoms. And the next stage of that is really developing predictive models, looking at whether, based on a brain scan done acutely, we can predict how the patient will be doing a year from now.
Yeah. And I was gonna ask, what do you see the sort of future of aphasia diagnosis and rehabilitation looking like with these new predictive models that you're working on, and with the history of aphasia being treated more through a linguistic perspective? How do you sort of see that moving forward in the field with regards to rehabilitation and diagnosis as well?
Mhm. Well, I do see or hope, very much hope to see neuroscience kind of playing a larger, greater role in guiding neurorehabilitation for individuals with aphasia. So, while I've done a lot of work in neuroimaging myself, this is a bit like shooting oneself in the foot, but realistically, at this point, there's nothing in neuroimaging that really guides treatment decisions in the clinic.
Hmm.
That's the reality. I don't want to discount the importance of neuroimaging, both for sort of our theoretical accounts of language or for treatment in the acute stage when it's important to determine what type of stroke the individual had, where to provide most efficient and life-saving treatment to them. So it has been great advances have been made in that regard. Um, but beyond that acute stage, like when an individual is discharged from the hospital with a certain deficit, difficulties in producing words, understanding sentences, from there on, the kind of selection of treatments is really based on their behavioral profile, what the therapist sees. So there is nothing in the scan um, at this point that will guide what the therapist does with the patient in the clinic. And in a way, I mean, I think that's unfortunate. I think we have under-delivered. There are insights to be gained from various modalities of neuroimaging that could support and hopefully enhance recovery. We just haven't been able to really uncover them and kind of bridge that um, theoretical theory to application gap. Um, I think I'm hopeful that in the future, kind of neuro information gained from neuroimaging, whether it's like location of damage or what networks are damaged or what residual functional connectivities there is still, there are many modalities and many things that we can extract from those neuroimaging scans. Hopefully that will guide selection of treatment, like intensity, duration of intervention. Maybe, and I'm being kind of, there's a lot of wishful and hopeful thinking here, but I think this is something within reach. Like maybe the information that we gain from a scan will tell the therapist, like, where is the optimal intervention window? Where is the kind of maximal neuroplasticity?
Hmm.
Now we think that most changes, gains in treatment can be made in the first 6 months following the stroke or traumatic brain injury, but maybe we can get a bit more specific. Or now there is even some thoughts that in the first few months, there is enough spontaneous kind of recovery already taking place, and maybe our efforts, rehabilitation efforts, are best sort of postponed till a little bit later when the kind of the patient is able to tolerate greater intensity of treatment. There is also this whole cost effectiveness consideration. I mean, as you know, in the United States, at least, it's all insurance based, and people typically exhaust and kind of their rehabilitation allowances. So there is also this kind of need to optimize to make sure that they get the most of that limited rehabilitation that they will have.
Mhm.
Mhm. So to summarize that, really, I hope that neuroimaging can better guide selection of treatments, duration and intensity, and sort of distribution of treatment throughout recovery. And also, I see greater role for different adjuvant, not just language interventions. Again, language is not an isolated function. It's a cognitive capacity in a way. So it is related and directly influenced by other cognitive abilities. And it's also kind of brain makes it possible. So anything we can do to increase neuroplasticity to optimize kind of brain health, brain function should have positive downstream effects on language. So that's kind of more maybe general what we consider today adjuvant interventions, such as pharmaceutical, non-invasive brain stimulation, or like physical exercise, something that I'm personally working on, uh, will become kind of more standard interventions that are offered as a part of this kind of comprehensive rehabilitation package to individuals with communication impairment.
Thank you so much. I think that was a great answer. It was super comprehensive. And I guess my one of my last questions to you was gonna be, what do you think really deserves what do you think in aphasia really deserves more attention from the broader community? Obviously, we have neuroimaging, but also you mentioned a sort of more comprehensive way to tackle rehabilitation and treatment. So, is there anything you'd like to add on that topic? I know you touched on it, but
Um, well, mm, I think I would like to really emphasize that point that language should not be regarded in isolation, and that we should not be treating kind of a cognitive capacity in isolation, but rather treating the person
mhm,
and helping the person recover rather than language recover. And here I see a vastly unmet need, specifically in individuals with communication impairments, is their sort of mental health, psychological well-being is often left kind of out of the rehabilitation focus.
mhm,
And I mean, part of that's kind of historically, psychological well-being is really becoming a topic maybe in the last 20 years. Before it was always treatment of a specific disability impairment, whether motor, cognitive, linguistic. But beyond that, I mean, there is a difficulty in kind of counseling in psychotherapy because psychotherapy is essentially talk therapy. And if the talking modality is in itself impaired, how do you apply psychotherapy?
mhm,
It's really complicated. Speech language therapists who are trained to work with individuals with aphasia, they don't know about counseling or psychotherapy. I mean, in the sense that they don't know how to properly do psychotherapy, and psychotherapists, counselors, they're not trained to work with somebody with whom they can't communicate easily. So they prefer kind of to stay away from this population, for lack of a better word, because they're not sure whether they're sort of they can use their traditional methods here. So unfortunately, often psychological needs of these individuals are really not addressed. And kind of in my work, I often see that sort of quality of life, levels of well-being are really not do not match the severity of impairment. So sometimes someone can have a relatively mild language impairment, but really be debilitated by it and depressed and not functioning well, and vice versa. Somebody who is with a relatively moderate aphasia that's quite evident has been able to successfully adapt, work around their impairment, find alternative of kind of means of communications or ways of being socially active, and is leaving a fulfilling life. So I think it's always important to remember this whole person and address holistically their needs. Um, so that's something that kind of the broader public should be aware about. And we as professionals in the field should be working towards kind of bridging that gap.
Definitely. And last question, for students passionate about this area, whether neuroscience or linguistics, whether more clinical or computational, what advice would you sort of give to get into the field, to get more interested and involved in neuroscience as a whole?
Oh, well, I mean, I think the brain is fascinating from whatever aspect, whatever scale you look at. And I think all work, whether it's clinical neuroscience, basic neuroscience, computational neuroscience, um, kind of is exciting, valid, and worth pursuing. I would encourage students to keep uh, their eyes wide open and not to quickly restrict themselves to a specific area of neuroscience or specific method, even if they might be particularly interested in a certain aspect. Because I think kind of the breakthroughs happened at sort of intersections of different disciplines.
Mhm.
So even if you are really interested in computational neuroscience, don't just get buried deep in those different computational modeling. Still stay attuned to clinical problems and kind of gain inspiration and insights from behavioral phenomena to that your modeling can help to address or debates that it can help resolve. And the same, like like if you're interested specifically in language, I mean, don't forget that language doesn't happen in isolation, that different cognitive capacities directly influence it, like ability to sustain attention on a task, or working memory to support language communication. So being kind of knowledgeable of what's happening or beyond your specific interest is very important to moving your research agenda forward and to kind of generating new questions and finding creative solutions. Another piece of advice would be to stay sort of, not if I want to say method free, but view a method not as a kind of an answer to it all, but learn kind of method, a specific neuroscientific method, whether it's MRI, intracranial recordings, or animal, wet lab animal work, is a means of finding an answer to your question and kind of being open about the methods. Learning several different methods when you are in school can be definitely advantageous to your career. And lastly, and here I understand that I'm maybe a bit biased having the clinical background, I do think that it's oh, staying in tune with the kind of the patient world with clinical questions is really important, because it really kind of provides, well, at least for me, the reason why I'm in this field is to kind of help people and address real world problems. And a lot of important insights can be gained from that. And it's in also furthermore, exceptionally motivating to see that you're making a difference in someone's life. The work, science work comes with a lot of struggle, self-doubt, a lot of dead ends. It's in a way, I mean, it's a rewarding career, but it can be a very frustrating career when you're not sure whether you're sort of making progress, doing the right thing. Uh, but seeing that you've made a difference in someone's life, as slight as it is immensely rewarding and encouraging.
Thank you so much. This has been awesome. I truly appreciate you coming on and talking to us at the club, and I learned so much, and I'm sure our club will too. Thank you, and I hope you enjoy the rest of your day.
Well, thank you again for having me. It's been a pleasure.